All right.
Only 2 down trees.
Nice.
Oh, wow.
One's my brother.
Dope.
Did you have to get the chainsaw out, Deb?
I have a big truck.
Just drove over it.
Oh, just roll right over it.
Over she goes.
Well, first you have to kind of nudge it, you know?
I can't do that with my Prius.
I have mine done.
I worry about driving over little ones and popping a tire.
And then you drive over it all.
Not a ramming speed situation.
They're all. Musical nameplates.
Every 3 weeks, I just put the fringe on. And then so every 3 weeks,
To make certain that was the right person sitting here.
You are Deb. Real white.
They all look so smiley this morning, don't they? It's like,
Feel situated?
yeah, go ahead.
All right.
I'm good.
Thank you. All right. Good morning, everyone. Welcome to the Public Health and Human Services Board for Cook County. This morning, I'd like to call the meeting to order. Tuesday, November 19th, 2024 at 8:32 a.m. The first item on the agenda is our consent agenda, and that includes our meeting agenda, the minutes from our last meeting, financial report, abstracts, and bills. Is there any amendment to the agenda or anything a commissioner would like to pull off the consent agenda?
Mr. Chair, I'd make a motion to approve the consent agenda as written.
Thank you, Commissioner Sullivan. We have a motion. Is there support?
Ginny got it.
Thank you,
I'll
Commissioner.
support. Somebody else.
There is the verbal. Thank you, Commissioner White. We have motion and support. Any further discussion? Hearing or seeing none. All in favor?
Aye.
Aye. Opposed? Motion passes unanimously. Thank you. Down to our next item is the introduction of new staff. We have Kristen Pedersen and Marissa Eckel, and I'll first hand it over to Allison McIntyre.
Good morning, thank you. Commissioner Channels, excited to welcome 2 new members to our Public Health and Human Services team in the last month. I'll let them and their supervisors say a little bit more about themselves, but we're really excited to have these positions in place. Can you go first, Dagmara?
Sure. So Kristen started I don't know when it started. 2 weeks ago?
2 full weeks ago, yeah.
2 full weeks ago. We are excited to have her on our team. And she is already training. She'll be she'll be starting with SNAP training and then a healthcare training. And yeah, she has a full plate of things to do. So we are very excited to have her.
Nice to meet you guys.
Welcome.
Good to meet you. Thank you for joining the team.
Good morning, Commissioners. This is Marissa Eckel. We're so happy to have her join us in Children and Family Services as a case manager. Marissa came to us most recently from South Dakota, where she did work in child protection. That's a state-run system there, child protection. So we're excited that she has that kind of background to bring to us, although officially she's from Wisconsin. So that's right. So she's like a cousin to the rest of us. And she started last Tuesday. So we're happy to have her. We just got her settled in her office, getting her trained. But yeah, she's going to be a wonderful addition to our team. Her partner works for Arrowhead Electric, and so he's had some busy days already. Last week, Monday was his first day, and then of course today, who knows? So
Wow.
They have quite the introduction to Cook County.
Yeah.
Do you want to say anything, Marissa, about yourself or why you're here?
I mean, I think you covered it. Nice to meet you guys.
Yeah. Good to meet you. Yeah. Thanks for joining the team. Any questions from any commissioners? All right. Well, enjoy your days, and again, thank you. It's great to meet you.
Thank you, Ross.
And our next item is our staff report, and we have Dagmara Smith giving our economic assistance and healthcare program update. Good morning.
Good morning. Okay, so I can't believe it's already been a year since the last presentation, but I guess time flies. Okay. So, Economic Assistance Unit administers financial assistance programs that helps low-income county residents meet their needs, their basic needs. And the programs that we work with are childcare assistance that assists with the childcare cost. We have 2 programs for Family Cash. It's a Minnesota Family Investment Program and Diversionary Work Program that help families with low income or families experiencing temporary financial challenges to pay for food, housing, utility bills, and also provides employment services with the goal of reaching financial stability and exiting the program. For single adults, we have general assistance, housing support, and Minnesota supplemental assistance. Those programs help, they provide small cash grant to help people who are age, blind, or disabled and have low income. We also have emergency assistance program that helps families or individuals secure stable housing. Healthcare programs, which include medical assistance, Medicare savings program, long-term care services, and healthcare access program. We also have a food support program and more. Definitely a burial assistance. That's another program that's not listed here. We serve county residents and residents who are in placement out of the county. We serve residents of all ages, people with disabilities, families and single adults, people who are employed or unemployed. And all the programs have income and asset eligibility guidelines, and it's different across the different programs. So we will, in next slides, there will be some graphs where we can compare the numbers from last 5 years, but just kind of like a summary. So looking from 2020 to what we know so far in 2024. Definitely the caseload peak was in that fall, winter time, 2022, 2023. 2024 caseloads numbers are very similar to pre-pandemic numbers. We did notice increase in childcare assistance cases, slight increase in family cash cases, and slight decrease in single adult cash cases. SNAP cases are pretty steady over, the numbers remain pretty steady over 2024, and they definitely decreased from that peak numbers in the fall winter of 2022, 2023. And definitely significant decrease in healthcare programs. So looking at, so this is a graph representing combined case count, and the blue color represents 2020 numbers, and 2024 is the orange line, and you can see where at the beginning of this year the cases were quite higher, and that line went down and eventually crossed with the 2020 numbers, and it kind of hovers very close to that. So we can see which month was the peak for cases. Looks like April of 2023, we had a total of 961 cases, and at this point we are down to 731 in October.
March. And Dagmara, I know you're going to get into this as we go program by program, but it's fair to say as healthcare programs are our largest caseload, that's really driving the decrease in some of those changes in the pandemic-related waivers.
Yes. Yes. So this is definitely the biggest change, is the healthcare cases decreasing, as during the pandemic, we did not renew any cases for healthcare, and those renewals started in July of 2023. So in some of the cases, those cases did not have a renewal for 3 years. So when we started doing those renewals, the individuals were no longer eligible for healthcare. This is a childcare assistance program graph. It's pretty interesting. It looks almost like an art project. But yes, it's pretty exciting that in 2024 we were able to bring those numbers a little higher. So we can see, and that's the highest in the last 5 years. We can see that on average we have 9 families that receive childcare assistance.
Dagmara, do you think it's safe to attribute some of that increased caseload to the increase in childcare capacity through some of the wage enhancement programs?
Yes, I would think definitely there is. This definitely contributed, and we have more spots available for the children to enroll, and yes, there's still a need. There's still families who do not have childcare spots, but I would say definitely this contributed. The family cash caseload, so MFIP and DWP programs, so that's our green line in 2024. The numbers are a little higher than the last year, and just kind of in the middle, and between the last 5 years. Food support program, I believe this is a brown, the 2024. Is it brown? I can't see it from here.
Looks reddish, I think.
Reddish,
Yeah.
reddish, red. Okay. So comparing to other years, the numbers I would say, are pretty steady throughout the 2024. And they are a little higher than pre-pandemic, but definitely lower than those peak months during the 2022 and 2023. kind of somewhere in the middle there. And the healthcare programs, that's where we see the biggest decrease. So the 2024, that's that brighter green line. We can see that this is at the lowest level in the last 5 years, kind of meeting the pre-pandemic blue line, actually hovering a little bit below. 2023 numbers, that's the darker blue, where we can see the highest amount of cases. So pandemic rules started in March of 2020, and just by chance, today's case numbers, not today's, October's case numbers for 2024 are 559. And the March cases of 2020 are 559. So right there at the pre-pandemic numbers. And the highest amount of healthcare cases, I think that's that 765 in April of 2023. Oh, no, that's the wrong way. And this graph represents total of applications received. The 2024 numbers are as of October 31st, 2024, so we still anticipate that we will receive more applications in November and December. So I would say it's safe to say that probably the numbers for the total for new applications will be close to 2023. We're at 192 right now. We should definitely get to over 200. So when we're looking at October 2024, we have 213 people who receive food support. We have 13 families who receive cash and food assistance through MFIP or DWP programs. We have 9 families who receive childcare assistance. We have 23 adults who receive cash assistance through general assistance or MSA. We have 972 people who are enrolled in medical assistance and 67 people who receive help with Medicare costs through Medicare Savings Program. And I have, let me just sketch up with those slides here, but I can give you, I think it was kind of interesting to look at the numbers at the snapshot of October 2023. So especially the healthcare program. So in October of 2024, we have 972 people receiving medical assistance. In October of 2023, we had 1,350 people receiving medical assistance. And individuals receiving Medicare Savings Program in October of 2023, that was 84 people. Emergency Assistance Program, that's the one program that we administer. It's a it's county fund for homeless residents or those facing a housing crisis like eviction or utility disconnect. Funding is limited. As Cook County receive $5,000 allocation for families for the emergency assistance program and $1,000 for single adults. In 2024, we spent our family emergency assistance allocation, and that was $5,000. We are expecting a new allocation on January 1st of 2025. And with emergency general assistance, so that's the program that helps single adults, we spent $767 out of $1,000 that it's allocated, and this allocation renews in July. With the emergency assistance payments, we were able to assist 4 households, and we issued those payments to secure stable housing. Year in review. I was working on that yesterday, and it's kind of a eye-opener. So we have, our team consists of 4 full-time financial workers working basically across all the programs. We have 2 full-time case aides and a supervisor. We have 191 cases in Max's system. We have 518 cases in Med's system, and we have 43 long-term care cases. In the last 12 months, so since December of 2023 until now, we have 4 new financial workers. So turnover is actually very significant. The worker who is financial worker that's here the longest, she just had 2-year anniversary. And then we are looking at a financial worker who started in March, June, and November. Also, our case aides are new, and they started in March and September. The turnover is due to many reasons. We had some internal promotions. We have individuals accepting positions with Department of Human Services, and then also individuals just looking for something else. So the 2024 definitely was full of training of new employees, which I actually enjoyed. I think this is one of the best parts of my day, is to teach new employees about the programs. Almost 2 months ago, we also implemented Caseworks, which is our new EDMS system. So that's, again, more training and more learning, but we are really excited about having this opportunity of using the new EDMS system. It's Caseworks definitely is a newer program and offers a lot of improvement in many areas, from the work that case aides are doing to what financial workers are doing, from scanning to creating forms to transferring the cases. Program is very intuitive. We are able to do things way quicker. We are also able to offer a online portal for residents to submit their forms. We are able to get e-signatures. Definitely we can see time efficiencies with Caseworks. It's something new it's, new things. We are excited about it. There is a learning curve, but after all, we are very excited about the program. We are also finalizing the post-pandemic healthcare renewals. The full process will be completed in June of 2025. We are in our last phase of that. And with the food support program, we return to time-limited recipient policy. This policy was on hold during the pandemic years, but we are relearning what time-limited recipient policy is and implementing that. It's basically what it is for individuals who do not meet any exemptions. They are between 18 and 54 years old. They don't have any limitations to work. They don't have minors living in their household. Then they're only able to receive food support for 3 months in 3-year time period. We are, as we administer the food support program, we have to meet certain performance goals. They are put on by federal government. It is expected that certain applications for food support, the application that's screens expedited, what that means that people don't have any income or any liquid assets to buy food. We have to process those applications within 24 hours. This would be ideal. That's the expectation of federal government, or at least issue a benefit within 5 business days. These numbers represent January through August of 2024. We were able to meet that expedited issuance within 24 hours and 66%, 5 business days with 88%. But after all, we were able to process food support applications within 30 business days. So that's kind of for all other applications, they should be processed within 30 business days, and we were able to reach that goal. Minnesota, State of Minnesota, Department of Human Services would like if we could meet the expedited processing, or at least expedited 5 business days processing, in at least 96%. So if you would take this, split this data by quarters, we didn't meet this in the first quarter, but we met the 96% in second quarter, and the numbers for third quarter are not yet available. Nope, wrong way. There was a lot of legislative changes that were signed in 2023, and they are rolled out throughout the 2023, 2024, and will be rolled out in 2025. We are, counties and tribal nations must accept applications for cash assistance by phone and video conference. This is a big change that was not something that we did before during the pandemic. I would say this was rolled out during the pandemic as all different waivers were put in place. We were required to offer this to across all the programs. The food support and healthcare remain after the pandemic, and we had to continue to take applications or renewals over the phone, and now also that was added to, this option was added to single adult cash programs. Effective, there were several changes. All of these several changes that are on this page and next page really about improving access to residents to gain access to benefits. Effective January 1st of this year, tribal per capita payments are no longer counted as income for cash assistance programs. Effective September 1st of 2024, Social Security income received by individuals at the level of $943 per month is not counted as income anymore for family cash. Effective October 1st of 2024, the assistance standard for general assistance increased to $350 a month. This is a huge change. This benefit, and this is the first change since 1986, when, and the benefit before was $203 per month. The increase, like I said, just started in October and is now subject to cost of living adjustments. So we are anticipating that this amount will slightly increase every year as other programs do. Effective March 1st of 2025, the family cash and single adult cash cases will transition to 6-month prospective budgeting and 6-month reviews. Right now, we do monthly case maintenance on those cases. Individuals have to complete forms monthly and need to provide proof of income monthly. We are like, if we are processing something for December, we look at the income they received in October. That's how we budget. And that's based on that, that's how much benefit they will receive. So starting March 1st, we will be doing this only once every 6 months. This definitely, I'm excited about this change from the worker point of view, but also from the recipient point of view. And more changes. Effective January 1st of 2026, the diversionary work program is repealed. So right now we have MFIP and DWP program, but DWP program is going away, and now the only family cash program available to Minnesota families will be MFIP program. The big change that happened, that was starting in August of 2023, we started processing healthcare renewals as ex parte. So federal Medicaid regulations require that states attempt to confirm enrollees' eligibility using information in a case file and reliable electronic resources before sending a paper renewal form and requesting information from the enrollee. Minnesota was not up to date with this process, and then finally was able to start to be in compliance as of August of 2023. So again, more learning, more training for all of us. A big change that that started January 1st of 2024. It's continuous eligibility for children for medical assistance. So for children who are determined to be eligible for for medical assistance who were under the age of 19, they have continuous eligibility for 12 months. So their eligibility cannot be closed due to, let's say, parents being potentially over income. 2023 Minnesota legislative session also extended this to children who are 19 and 20 years old, and actually it went further and also extended that for children who are under 6. So that part is effective January 1st of 2025. So so what that means that basically as of January 1st, 2025, children who are under 6, if they are at any time, if they are determined to be eligible for medical assistance, maybe when they are 2 months old, this eligibility will continue until they are 6. And then the children between 7 and 20 years old, that's just the 12 months of continuous eligibility. What else? The 2023 Minnesota legislative session also amended state law to extend Minnesota Care to Minnesotans who are undocumented individual. This begins January 1st, 2025, and Minnesota care coverage for people who are undocumented will be state-only funded. Looking ahead, we have more training, redistributing caseloads and tasks, and working with caseworks, implementing medical assistance, continuous eligibility for children, also learning how to process Minnesota Care application for undocumented immigrants, and the 6 months reporting for MFIP and GA. Oh, no, wrong way. Okay. Is there any questions? I know there was a lot of information.
Yeah, Commissioner White?
When you were talking about the expedited process,
Yes.
could you just kind of, here you have a child or a family that comes in.
Yeah.
What are the basic steps that you have to go through?
So if we receive an application, we and the individuals are requesting food support, we first need to screen the application, and expedited SNAP is available for the following types of the units. If the unit has less than 150 in monthly gross income, and 100 or less in liquid assets, so whatever they have in cash or any bank accounts, or otherwise units whose combined gross income and liquid assets are less than their monthly housing expenses. And the housing expenses that we are looking at, that's utilities, and so it's a utility standard and rent or mortgage that they pay. So at that time, every food support application, every food support and cash assistance application requires an interview. So we will do an interview. We usually do them over the phone, but we also do them in person if that's what someone prefers. And then we gather verifications and approve or deny eligibility depending if the family or individuals are eligible. With the expedited process, if we do have to request verifications, that those verifications are postponed. So we are able to issue assistance and then for that month, and then individuals or families have to provide verification by the end of the month.
Dagmara, could you share a few examples of what mandatory verifications are for SNAP, or what type of documentation we have to gather to determine eligibility?
Yeah, so in order to issue expedited food support, the only verification that we need is proof of identity. And then if application is not expedited, then not really. All the SNAP applications require proof of identity, proof of income, proof of housing expenses. Housing expenses, that's not a mandatory proof, but it could be beneficial as if verified, will be allowed as a deduction. So it could lower the income and increase the potential benefit. Also, we have to verify student status for individuals who attend institution of higher education. We have to verify medical expenses for individuals who are 60 years or older. I think, and that's all. Food support program does not have asset limits, and does not require asset verification.
Okay, thanks.
Mr. Sterling.
Thank you, Chairman. Well, there's certainly a lot of moving parts here. Could we get a copy of this?
Yes.
Thank you. Especially when you have to, deal with the feds and the state, and then you're trying to adjust everything to what the new year is going to bring. But I'm going to bring up just something way off the chart here, because we're talking about county services. So in the Star Tribune, they had an extensive article about counties who are having to up their costs for burials. And I'm wondering, in our county, what's the budget? Have we had a few? Or how do you see that in the future here? Because many counties are dealing with the cost of that.
Yeah, so Allison redo the burial policy maybe 2-3 years ago now, and that's when
2 years ago.
2 years ago, okay, and that's when we increase the allowable burial assistance amount. Usually we are required when we're working with that program to technically accept the rate that the funeral home is requesting. So even even if maybe that amount will be higher than what's allowed by our policy, many times we have to accept what they are requesting. I can look up the numbers. I believe it's $1,800 for cremation.
Somehow I've got a figure in my mind that it was like $200 toward, and this is a few years ago, toward a burial.
Yes.
And I think that's what people are dealing with. It's all going up now because of the funeral costs, and they're trying to adjust their money at the, and where does the money come from? You have a little
These
budget?
are
for
levy
that?
dollars that
Levy
we set
dollars.
aside every year for
Okay.
county paid burial. And for 2024 year-to-date, we've expended $3,245 of our total $5,000 budget.
Mm.
So we're in
Okay.
good shape
Okay,
for the
for
year. But we would, if eligible, grant burial funds, even if we didn't have the budget, because it's just a
Okay.
requirement
Okay.
for counties. And that application and eligibility process is a little different from some of the state and federal programs. As we have our own county policy that Dagmara referenced was just updated a couple years ago. We have an appeals process for county burials. With SNAP and cash programs, the state agency and appeals hearing judge is overseeing any appeal that might be brought forward by an individual or an authorized representative or family member. So we have an internal process for appeals for county burials. But I don't think we're seeing a significant increase in the volume or the amount of burial funds requested through our department.
Thank you.
Any other questions? All right. Thank you very much for the presentation, Dagmara.
Okay, you're welcome.
I hope the next
Thank
year
you very
goes as
much.
quickly as this one.
And yes, and hopefully training and turnover is not going to be
Good point,
the,
yeah.
the point of it.
Yeah,
And Dagmara is
Thank you.
very humble and really undersold the fact that she is really carrying multiple caseloads right now because of the turnover and the length of training required for some of these programs. Medical assistance, long-term care services in particular, it's a year to a year and a half to even be eligible to take that training. So our most senior staff person has been here for 2 years, so we're still in the process of really spreading out that program knowledge across the department. So thank you to Dagmara for all that you've done in your first year on the job, carrying multiple complex caseloads, onboarding new staff. As Dagmara said, she enjoys training and mentoring the team. That's really evident in her work. So thank you, Dagmara.
a huge, huge benefit for the organization if you enjoy that, considering we have that to do, right?
Yes, we do.
Yeah.
We have a lot to do, but I guess I've totally spaced it out. Definitely big kudos to my team. They show up to work every day, and they're in front of the lines, making sure that our county residents can access the benefits that they are eligible for. So definitely it's a teamwork. This would not happen without them, and it's great. It's lots of positive energy, positive attitudes, and that's how we get through the day.
Thank you. Thank you. The next item on our agenda is the director's report. Alice.
As reflected in the updated organizational chart that was included in the meeting materials, we have filled 2 vacancies in the last month. You met Kristen this morning, who joined us just a few weeks ago as an eligibility specialist. As Dagmara mentioned, she's starting out with healthcare programs. Kristen comes to us most recently from North Shore Health as a radiology tech, so brings that background of medical terminology, learning a whole new set of acronyms in her new role. Marissa, as well, joined within the last couple weeks as our Children and Family Services case manager. That was the new position that the board authorized to respond to the increased caseload across our child protection services. And Kristen was backfilling the vacancy that was created by Ariel's promotion to a social worker. We are continuing to recruit for our licensing case manager to backfill Nancy's position, as well as the children's mental health case manager that's been vacant for several months following Marissa's transition to waiver case management. We met with the temporary social work agency last week to discuss next steps for placement of a temporary staff person for that children's mental health case management role. We again conducted an interview for that position, made an offer. That offer was declined. So continuing to struggle to fill that position, we have reposted it and are also moving forward with that temporary social work placement. We're also connected with a local resident about covering an upcoming family leave anticipated within our social services team. That's it for staff updates for the last month. Department-wide, big news for us in the last week is that we just received notice from the Department of Human Services that we are approved and certified to provide adult and children's mobile crisis response services. So that has been a significant lift for our team, especially while understaffed, to put together all of the policy documentation and start building out that infrastructure framework for a more formal mobile crisis response service delivery locally. So we do have that approval from the state, and our next steps will be to register as a provider with the state to be able to bill for those services. And we are also deep into the discovery phase of implementation of a new electronic health record with Qualifax. This week we are gathering data and reporting to the Credible team for our next phase, which will be configuration of the system. So pulling together client information for existing clients that are being served through Wilderness Outpatient, what types of data fields we want to be gathering for the mobile crisis program, our staff information, program information, so that when the system is configured, it's representative of the services that we provide locally. We received a notice just yesterday from the Human Services Performance Management Team in a revised report that we have met and or exceeded all performance standards for adult protection services and child support services. So the time periods that were measured vary by program area. For adult protection, this was looking back at July 2023 through June of 2024. For child support, that period that was monitored was October 2023 through September 2024. So for adult protective services, the standard is that the percent of adults reported as maltreatment with initial disposition for response made within 5 working days. So essentially what that means is that at the point that our agency receives a report through MARC, which is the Minnesota Vulnerable Adult common entry point for people to report concerns regarding a vulnerable adult or a person who may be a vulnerable adult, that we respond and make a determination within 5 business days. So for 2024, our county performance was 96.3 out of a total of 27 vulnerable adult reports that were received within that time period. So that is 26 out of 27 were responded to within that 5 days, which is well over the 90% threshold set by the state, well over our regional and state performance trends. So kudos to Martina in particular, who's really been carrying that vulnerable adult protection assessment caseload for some time now. Within child support, we received notice that the performance improvement plan that we were under previously was closed. That was within less than a year. If you don't remember, when I first reported on that performance improvement plan, we were less than a percentage point off of the threshold. Again, our small caseload was really driving that, that coming in just under the performance standard. I'm working with Dan to schedule a future presentation to this board so that he can share more information on the services performed by Carleton County Human Services for Cook County residents within the child support program. We put out a media release earlier in the week, maybe it was late last week, about a newly established Food Access Council. This is a project being led by our statewide health improvement partnership coordinator, Christina Matson, as one of the goals identified in our 5-year community health improvement plan. The kickoff meeting is tomorrow, November 20th, at Cook County Higher Ed. And you can learn more about those efforts in the media release that was put out on the 12th and is posted on our website. Lastly, in the world of outreach, last month I mentioned a visit to the library here in Grand Marais to talk more about outreach and partnership, how we can support residents who might be accessing services or looking for services at the library. I was just there with my family earlier in the week and saw that they have a resource wall now in the entryway where they're sharing a lot of program information from our department and other service providers locally and regionally. So thank you to the library for your partnership. I also want to recognize Melissa and all the work that she does on getting information out on programs and services. An effort underway right now is to increase access to the community resource guide that we maintain and update as a department. Melissa is putting together flyers with QR codes so that if someone sees that resource guide or a flyer advertising the resource guide out in the community, they can access that information in PDF form from our website. Happy to take any questions about staff or department updates or otherwise.
Thank you. Questions? Yeah. Mr. Johnson?
Last month, we talked about a training information. Have you been working on
I
compiling that?
have not been able to prioritize that time-wise in the last month, but I should be able to pull that together this week. My schedule is a little more open this week and the week ahead, but I'll be happy to share that with you and the rest of the board if that's of interest more broadly.
And my other question was about our crisis response worker, and has there been movement on his ability to move to Cook County?
Still looking for a place to land. I think there have been a few options that have fallen through, so happy to take any other recommendations or resources that people might have for housing. I'm working with Allison P. on that right now. She's aware of another rental in the community that might be opening up, so hopeful that that might be a good fit for him.
And has there been discussions about how long we're going to let this go? About how long it's appropriate for a crisis response worker to be working remotely?
Yeah, those are conversations certainly that his supervisor has had with him in terms of what our expectations would be for having a person on site. There's still quite a bit of work that can be done remotely at this point. Certainly by January 1, when we're certified to provide program crisis response services, our expectation is that we would have someone here
Okay.
on
I
site.
just wanted to know what the timeline was here, how long we're going to let this go. Thank you.
Thank you. Oh, Commissioner White?
Should that be a board policy? I mean, should we have a discussion about this? I mean, this is crisis. This isn't the normal little crisis. Excuse me. It's not the normal, we have no food or I'm homeless crisis, but it's crisis. And so if the person that we have to help the person in a crisis isn't around, I think we should have a discussion about how long that person can. I mean, I understand they've got to live somewhere better than their car, but I think we should have a discussion about that at some point.
And just to be clear, Commissioner White, we are providing mobile crisis services at present, and we have coverage for that right now through other members of our behavioral health team, primarily through the supervisor, is providing mobile crisis response services while we don't have a person here on site.
Okay.
And you said last time that there's a training period, so even if the person was right here, they wouldn't be seeing people, they'd be training, so there's that. I don't know the length of that, right? Is that right?
Yeah, I mean, they would likely be shadowing
Yeah.
and going out with the supervisor, another more experienced staff person to respond to the few calls that we do receive. We anticipate that volume to go up as the program is formalized and we do more outreach.
Can you remind us how long the position was open before Mr. Ritmo?
I believe it was 18 months. May of 2023 was when it was vacated by the previous employee, and David started in late October, early November? Late October.
And we are looking into temporary services for other positions, but this position, if vacated, might not be a good, or could be a good fit, or how?
Yeah, that's entirely possible that we could work with a temporary social work agency to assist in the placement of a crisis response worker.
I'll hope for housing, but yeah, it's important to look at our options. Okay. Well, thank you, Allison.
Yeah, thank you.
Any other questions? Move on to our committee reports, since we have no items for board action. First one is the Active Living Steering Committee. Commissioner White.
Well, Commissioner Storley will know better, but the little bridge, in the west end of the county, it's connected. And so that was the big topic of conversation, that the opportunities to not walk on the highway on the west end of the county is expanding. So that was a very big thing.
Nice. Thank you. And then we have AEOA. Commissioner White.
2 new board members, Linda Bauer and Jess Rodney. And Jess Rodney is also in charge of the Christmas program, that you see the little cards on the Christmas trees at the banking institutions in the county. Jess has single-handedly taken care of that program. She started it and she's done that, and the hub will now be taking over that. This is a transition year. It's time for her to do other things in her life, but she's been incredibly passionate about this. And the other thing for the, down at the hub, is that they had a strong conversation about the AEOA buses and the distance that they do not go from Grand Marais. They don't even make it to Cook County Home Center when they're going to the east. And so if you are a person in the public and you need to have a ride from AEOA with the transit bus, please call so it can be documented. It doesn't mean the bus will come, but we need to have numbers to show that it's needed. So that's important.
And just to clarify, Linda and Jess are on the AEOA board or on the hub?
No, the Cook County Council on Aging Board.
Okay.
That board.
Any news from AEOA and the board itself?
No.
Okay. Okay, thank you. And then Arrowhead Health Alliance, Commissioner White.
Oh, that's me. They don't meet until, we met last month, and we don't meet again until well into December.
Okay. And Arrowhead Regional Corrections, Commissioner Johnson.
We had a busy meeting last Friday. We have a new director that has been hired. Becky has moved up from AJC to be our director. I think that's a very good fit. The other discussion item was sublocade. I don't know anything about this, but it is for people with opioid addictions, and instead of giving daily medications for that, this is a once-a-month shot that they have found works really well. And it really helps when somebody is there and then leaves, and there's making sure there's no gap in medication. Unfortunately, this is very expensive, and so St. Louis County has already set aside $100,000 of their opioid funds for reserve for their residents at NERC, so that this can continue. They are asking the rest of the boards, the county boards, to consider setting aside money instead of increasing our shares. The usage of it, most of the people who are receiving, I wrote down here, so far this year, there's been one from Carleton County, and that has cost Carleton County $10,000. There's been one at St. Louis County, and that has cost $20,000. The fact that the rest of the counties have such small numbers there, they are suggesting that they just bill us for that if we have somebody there that needs that service. That's like $2,200 per shot. And so, St. Louis County has already agreed to this. It was brought up for discussion of how it should be handled by the board. The board decided, since this was new to the other 4 counties, really, we hadn't discussed it. We were to come back to our boards and get approval. I didn't get a chance to get this information into the board packet for this meeting here, but I can make sure it gets in for our Tuesday meeting so you can see this. But we need to either support having this available for people if they need it. We haven't had any residents there lately that it would apply to, but the other thing that came out of this discussion was that this is not reimbursable through medical assistance. And there had been legislation last year that did not pass to make reimbursements so the government would pay for these sorts of needed medications instead of counties. We do the same thing with our law enforcement, and so this is a state issue, but it should be one of the legislative priorities for this coming year. So I didn't know if we wanted to come to consensus with this board today about moving forward, or should I put this on the agenda for next Tuesday?
I know nothing about it, but I would like to learn more about it. And just when it's more appropriate than other treatment options. You're saying, like, I'm guessing the other ones are daily?
Mm-hmm.
Yeah, and then this one is monthly, and it's for residents of NERC.
Right.
What is the cost for daily treatment?
I don't know. I didn't get that information.
Yeah.
But they found, according to Becky and, yeah, I'm blanking right now, and Wally, they have just found, for the cases that they've had so far, they are more impressed with this drug than the other drugs that they have been using.
Mm-hmm.
So, I don't know any, hadn't even heard about it
Yeah,
before
all right.
Friday's meeting.
Well, it's probably, I guess, yeah, we should probably get that on the next agenda.
Okay.
And then hopefully we can get some more info. So, Carleton County is using it. So-
Well, I don't know, they didn't, actually, the Carleton County Commissioner, I didn't get a chance to talk to after that meeting. He left right away, but, they just said that $10,000 they've spent. Now, whether that's come out of, ARC budget anyway, or were they submitting that to Carleton County for reimbursement? That wasn't clear. I realized after I finished my notes, and I didn't get a chance to talk to the Carleton County Commissioner Friday afternoon.
Yeah, do we have historical data for our community as well? Like, it's not currently in need, but it could have been a past need. Do we have any of that? Or is that something we can?
Do you have that information? I did email our county attorney and Allison, but you were gone, so, and it was my fault for waiting until 2 days before the meeting to say, because I asked for their opinion, what is this? So do you have data on how many residents we've had? Otherwise, I can reach out to.
No, I was thinking about that nice annual report you shared earlier
I
in the
know,
year. If that
it was
had any
probably
data.
in there, and I.
Okay.
Yeah, look
Well, I
at
can
it.
dig into that too.
I don't have the numbers. I shouldn't guess, but I would guess under 5 a year. I think that's a really safe guess. Yeah, and likely less than 5.
Well, yeah, let's put that on, I guess, next Tuesday's agenda to discuss more. And we'll see what kind of data we can get there, and I'll dive into the ARC annual report to see what our numbers were in this past year. But even just the 1 year, maybe they have. I guess I'm not even familiar enough with the whole report to know if they've had the trends in there. Unless, do other commissioners have other thoughts for how to respond?
I think we definitely need more information.
Put it on.
Okay. Thank you.
And please let me know how I can support that, if there's any additional data from the department that I can provide to inform that discussion.
Would perhaps Sheriff Eliason have the data on people that we've,
I think that he'd go to the same sources that we would.
oh,
Yeah, I think it's more of the treatment, I'm guessing, or the
Yeah, I have
just
data
NERC, I
on
guess.
probation, but I don't have the data. I mean,
right.
of residents over the last year, but I can reach out and ask.
Yeah, because it makes, I can very easily see someone who is, on probation and outside of NERC, how that benefit, clearly it would be beneficial while they're still a resident there. Yeah, it'd be, I can see where this can get complicated. But it sounds very promising if they're like, this is the way to go. So whatever's gonna help our residents, I think, is probably what we want to lean into. It's my inkling, but I would like to know more, I guess, too. Yeah, thank you for bringing that forward. Child Care Solutions Subcommittee, Commissioner Storley.
Thank you. We have not met. I would guess we're going to do it in December.
Okay. And Community Health Board, that's me. We have our Personnel Committee meeting this Friday, and then I think reported on the past board meeting already. The Local Mental Health Advisory Council, yeah.
I brought the wrong month of notes here, so I don't know.
I could reference the notes. I wasn't present,
Yeah.
but I know that Melissa uploaded some of the notes already, so if you bear with me, I can pull that up. And it was a lot of information from our public health team. We
Yes.
followed up on the demonstration that we had at our last meeting in October from an organization called Credible Mind, which is a mental health resource platform that is currently in use by other counties and health boards throughout the state and nation. It's really a national platform. So there was some discussion and support about exploring that as a resource for our community, and that our public health team would start seeking out grant funding to offset the expense of that investment. Members of our public health team, specifically Andrea and Rocio, who are working in prevention, shared a draft mental health resources for youth and families handout. Got some feedback from the council on additional resources to include in that document. We also, the council also discussed inviting an organization called Outfront Minnesota in the future to share information specific to the mental health experiences of LGBTQ+ community members. We had a youth mental health first aid training at higher ed over the weekend. On Saturday, we have 2 staff, one from each of the 2 schools in town, Great Expectations and ISD, who have gone through that training to be train the trainer. So part of their requirement is to offer that training locally. So that was the training that we had on Saturday with Sarah from ISD and Dane from GES presenting that curriculum. I think that about covers.
Yeah, it was a pretty short meeting, really.
Okay. Thank you. And then we have restorative justice. Commissioner Johnson.
Let's see, that group meets tomorrow morning to discuss a grant application to hopefully, I'm not really sure what this is, so I'm going to rely on our county attorney to fill in here.
And I will do my very best. So in 2023, I think it was, the legislature created this new Department of Restorative Justice, which I think is under the umbrella of DHS somehow. Maybe not.
I thought it was Department of Justice.
Department of,
Yeah, what, I don't know. Okay.
not sure.
Corrections.
At any rate, what it also in the budget bill set aside funds to fund local restorative justice programs. And it has taken the last year and a half to actually get the grant program going to actually fund those local programs. And so we are now Cook County, Minnesota Restorative Justice, I'm on the advisory council, so I say we, but are submitting an application for that funding at this point. Apparently, funding can be up to $500,000 per program, but this would be really helpful for the program because they've recently made a couple of really high-quality part-time hires. That are really improve the program, in my opinion, and have a lot of potential to continue to improve the program and serve more folks in the county. So this would continue to fund their positions. So that's, and the grant application, I saw the draft last week. It's really well written. I think it's written by one of those new part-time employees. So I think there are high hopes that we should get some adequate funding because this program has been in place for 5 years now. It's not like more than 5 years, close to 7 years. It's not a brand new program started just to get these funds. So
Great. That's very exciting.
And just a reminder for members on that council, we're meeting here in person at the courthouse tomorrow, here in the commissioner's room.
okay.
Council on Aging, Commissioner White, was there anything more? You already gave a report there.
But I do have 2 other things that aren't on the list.
Okay.
And I would turn them to our interim administrator. It was the 911 meeting that was led by Jay DeCoux about, of course, it was radio communications and between which ones are we going to go with? He has this $400,000 grant burning a hole in his pocket. Not really, but it's really going to be beneficial for communications for all of our agencies and organizations. But Rowan, if you have any questions, he's the man. And then the other one was about the, labor management, and we just met and there was a discussion. Rowan was part of that too. So that was about it.
Okay.
Well, wait. We did take a walkthrough with the BKV group at the law enforcement center, and they took interior measurements, and they found all the warts and flaws and drips coming through the ceiling. No, those were taken care of, but it was with the maintenance, with Brooke, BKV, Rowan, I forget whom else, but people in the know, and to go forward, and they will be doing preliminary drawings, and it was very informational, so,
Nice.
yeah.
Thank you. Emergency preparedness, Commissioner Sullivan.
We did not meet this month, but those of you that were listening to WTIP this morning heard Mike Keyport on there talking about this is Winter Weather Awareness Week. It should be snowing, not raining. But he just reminded our community about how to get prepared for extreme weather in the winter. And also he mentioned that they're continuing to work on our hazard mitigation plan. They're compiling all the input that has been received from stakeholders and are kind of comparing the input with the current plan to decide what needs to be removed or what needs to be added. So we'll have more of an update next month.
Healthcare Planning Committee, Commissioner Storley.
We did not meet.
Okay, then NACO, anything there?
One of the best winter preparations you could make is have good tires.
Mr. Keyport mentioned that. Time for snow tires.
So at NACO, we've been discussing about prioritizing and developing and advocacy strategies. And the topic right now, the heading is mental health. And underneath all of that are the different areas that, that we're concerned about. Rural care health also. Hospitals in various parts of the United States are having to close due to budget restrictions, and nursing homes that are attached to that then are gone too. So it's a huge difficulty within the United States, because I hear from people all over the country at these meetings. And then caregivers, you know, for them to have a good wage and maybe a retirement too. So that's a discussion that will obviously be ongoing within the greater group that I'm concerned with. And then when you get all of these put together, then we need the federal and state support in order to identify the priorities. But the good thing is, between now and when NACO meets the 1st of March, we have AMC. And so when I go there, I'll hear a greater, broader concern about what's going on, and with all of us too. If you have concerns or topics that you think I should know about and talk to the folks in this country, then let me know so we have some time to do this. We do not have a meeting in December because they have a Western gathering in California, but because we're going to NACO, that'll be my chance to, like I say, put stuff together to prioritize some of the areas that we feel are important from Minnesota, and you know, it goes all around the country. All 3,045 counties, we all have the same concerns. So appreciate if you have any thoughts too. Thank you.
Thank you. Northeast Minnesota Office of Job Training, Commissioner Johnson.
Well, I don't have anything to report there, but I do have something to report about the community center and extension.
Please.
If I could do that, because realize what was discussed there, you know, really fits well with what's happening with this group of people here, as far as health and wellness. So community center, I want to report the skateboard park got resurfaced. It was done. We paid for the materials. Chris skilled them. Shout out to Chris, he donated his labor, so great, kids are loving it, I hear it's wonderful. The community orchard was very successful this year. 4 bags of apples went to the food shelf. The downfall went to farmers. 1 bag of apples went to the culinary art programs. They also went to the schools for their school lunch programs. There were many activities the teachers were doing, not only in the orchard itself, but in the classroom. So they are looking to kind of organize their volunteer list for next year. So that's working. The farmers market had their banner year. That is a very successful program. And talking about SNAP, Sarah got that SNAP program initiated up there. So $10 of SNAP equals $30 in buying power. And that was very successful. There's also the Power of Produce, which has no income limits, which is for people age 65 plus or kids 4 to 12. And I wrote down there were 120 kids that participated this last summer on that. That was very popular. And then WIC. And I apologize, I didn't take really great notes, but you can read the minutes, the exact details, or talk to Sarah. But $12,580 was spent in these programs alone. That's not just other people buying things there. So this was very beneficial to our community. So when we're talking about in our budget for next year, we do have a part-time assistant in that budget. If this program keeps growing the way we expect it to grow, because Anna's already got ideas for next year of how to expand on that. This is a heavily used facility in our community. The log cabin is booked solid Monday through Thursday. Youth volunteers. We had 17 youth volunteers this year. 12 of them volunteered over 500 hours. That's for ages 11 through 14, where they volunteer to earn money so they maybe can get their ski pass or take music lessons or whatever they're working towards. So that was pretty great that we had 17 involved in that program. And the other really good news that I heard was, well, hopefully we have ice this year, but all of the ice makers and warming attendants are coming back December 3rd. So let's hope we have a job for them on December 3rd. And then extension, another just great information and classes available that, you can go online to the extension and check out really helpful resources to our community. So I think that's all I have to report on that. Thank you.
Thank you, yeah. And I know that the 65 and up is new, it was new this year, and versus the Power of Produce for Kids has been going on for a few years now, and so the thought is that there's going to be more usage as that it becomes more familiar with the 65, or that's the hope at least. So, and that ties in well with the North Shore Collaborative. That Power of Produce was one of the grants that the North Shore Collaborative awarded to the Northwest Food Project for that Power of Produce. And there was a good handful of other grants awarded down through Lake County and up the shore, Finland in particular. And one thing we discussed a little bit is there was a program that used funds in different ways than was applied for, and the use wasn't inappropriate. It was just different than what was applied for. And so we're asking applicants and I feel like this is pretty standard, if there is a variance in what the funds are going to be used for, that they just ask about it, right? Instead of just doing it and then getting reimbursed. So kind of a harder conversations. And then, as far as the LOTS program, the reading program, the Grand Marais numbers were low, but there's going to be partnership with the libraries to try to leverage reading within the libraries makes a lot of sense instead of outside of that. And so we're hoping that's gonna do better. But there's distribution in Grand Portage as well as the West End. And then in Lake County too, those were still really strong. That's probably all to report there.
Yes. About the Power of Produce there from the collaborative then, is that continuing or was
So,
it a set
yeah,
number of years to do that?
So the funds were not fully expended and, the board said go ahead to roll those over. And so if there's another application, then we'll just take that as it comes. I'd expect it would do well, especially based on, the impact it's had in the community and just nutrition, especially with kids, being such a priority, so. But, yeah, it's kind of a weird situation in that the funds coming into the North Shore Collaborative are just on the decline kind of continually. So we're kind of just spending down the reserves, and other collaboratives around the state have kind of just gone away because of that. But there's still a healthy reserve, and we're trying not to just, get rid of it. We're just, trying to balance the impact versus what we got. So, but time will tell there. But I'll do my darndest to advocate for it. I know the impact. Public Health and Human Services Advisory Council. Frank is not here today.
And Frank did reach out to indicate that he wouldn't be available to attend. I just saw that email this morning.
Oh, okay. Commissioner Johnson, do you have any?
I don't have my notes for that
Okay.
one in front of me. It was a very small group meeting, as I recall. We got written reports from most partners, and I don't remember anything standing out off the top of my head right now.
That's fine. Is there anything?
I was also not
That's
in
right.
attendance.
We were a very small group. Grace led that one. Now I'm remembering that. Yeah, thank you.
But I have notes to reference.
You do have notes?
Do.
Oh, if there's anything. yeah.
Kudos again, Melissa, for being up to date with notes.
Thanks, Melissa.
So Grace shared quite a bit about the cannabis ordinance that was passed by the board and some of her efforts to help inform that process from the public health prevention perspective. She shared Attorney Hickens' article and then some of the other outreach that was conducted as a part of that engagement. But yeah, beyond partner updates, not much else to that meeting beyond the cannabis discussion. And our prevention coalition is doing quite a bit of work with cannabis education, outreach prevention as well. That group meets this afternoon and monthly on the same day as the PHHS board at Higher Ed.
Okay.
And Andrea Orist is the point of contact for that committee.
Okay, thank you. Anything else for the good of the order? Doesn't look like it. That brings us to adjournment. Have a great day, everyone.